Good afternoon. Welcome to another week with us, Neethu's Academy. I am Vinod James. Welcome to another reading live session with us. How was your weekend? Did you all enjoy the great weekend? Yes? And another month. And there are few who have already written the exams. So all are eagerly waiting as we are always eager to hear from all our lovely students what have happened and all those things. So, how was your weekend? Were you all working, relaxed, went somewhere, studying? What were you up to? What were you up to? Yeah. So, as our students are just joining, so again, welcome to Neethu's Academy live reading session with me. I am Vinod James. So, what are the things that we are doing in here? We'll be talking about two things, one a part B question as well as a part A, which we have already shared on the exclusive reading telegram. See, why we keep on emphasizing on the aspect is, see, we have seen students asking, in the official Neethus Academy, Ramya Gopi, good afternoon, thank you for the bouquet of flowers. Lakshmi Devi, good afternoon. Linda George, good afternoon. Very, very, very good afternoon to all my lovely students. So as I was just mentioning, we have seen a lot of students saying, please add in all the four modules. Please be aware of it. We do not have four modules Telegram group. We only have two groups. One, an official Neethus Academy Telegram page where we have just pinned the link, and the other one is an exclusive reading Telegram page. That's the only two groups or two Telegram groups that we have. Maria Rose, good afternoon. A new name for me. Is there anybody who's attending for the very first time? Please do let me know that you're attending for the very first time and also where you're from. Okay, it just gives the pride to tell that I have people across the world where I know, yes, I know a person from there, I know a person from here, because, and also for the other students, because they should know that the group that they are learning is a multi-diverse group, okay, where people come from across the globe. Okay, like we have people from Africa, South Africa, Australia, Israel, New Zealand, Ireland, UK, Maldives, Mauritius, Nepal, India, of course. Rani Robin, good afternoon. All parts of India. Okay, so it's just to tell you that you are in a platform where it is, multifariously diverse. Tajna James, good afternoon. Ramya, good afternoon. So the whole reason why we come in front of you is to make sure that we come and aid you from where you are to the next level where you can go and grab your dreams. Vinu George, good afternoon. Anu's career, good afternoon, sir. I'm first time. Thank you very much, Anu's career. Where are you from, Anu? If you would let me know, if it is okay with you. It's not something which is mandatory, but if you wish, please do let us know. We'll be happy to know. Okay. And the other one about the official Telegram page that we have. One, the official Neethus Academy Telegram page, where not only that all the new insights have been mentioned, Soumya Shijo, good afternoon, but also we'll be uh, giving you link for Chris's listening class, grammar challenges, all those insights that we want to make sure that you are of aid will be given in that official Neethus Academy page. Veena Boral, good afternoon. So all a lot of names are very much known for me, but there are few names which I'm not familiar with. Rini Joji, good afternoon. Aninichu, good afternoon. After a long time, Aninichu. Anus, I am from Palakkad. Okay, fair enough. I know very much about Palakkad. Okay, it's also some place where I grew up. So good. Happy to know that there are people from my own place as well. Good. So apart from that, um, the other Telegram group that we have, that's the official Neethus Academy. Sorry, that's the official Neethus Academy reading page, Telegram. Okay. Jane John, good afternoon, new name. Anthony San, Santosh from Dubai. Okay, very nice. Dubai, I have more people now. Jyoti Thakur, Pune, isn't it? After some time. Tinjumol Jishin, good afternoon. Shija, good afternoon. Sneha Gopi, good afternoon. All those profound names which are always there. Okay, good to see a mix of known people along with newcomers. So that's the beauty out of when you come and do the live session. And why I keep on asking is there are lots of students like you all who keep on sharing the very same link. So when you share the maximum, the more new people who are unaware of such free classes become aware of it, and they also are benefited, isn't it? Reshma Rajan, good afternoon. Tintu Sagar, good afternoon. So, of course, without you, we are not there. So, you are our patrons. Whatever we do, you do a lot of support for us. And on top of that, Anit Maria Jason, good afternoon. Kripa Linson, good afternoon. New name. Preeti Matthew, good afternoon. A lot of new names, but only very few have said that you are new. One from Palakkad and the other one from Dubai. Bharati, good afternoon. Priya Sunil Kumar, good afternoon. Nimi Paul, good afternoon. Josephine Bindu, good afternoon. So I hope you all attended Neethu Madam's live class. Hope it was beneficial. I'm sure that it was. Yeah, Sneha KG, good afternoon. Aninichu, okay. And just a reminder about the Nurses Day Award, which Neethu's Academy is proud to present to all you lovely nurses out there. Okay, Neethu Riji, good afternoon. Tina Agnes, good afternoon. Anju Kurian, good afternoon. So if you think that you are one nurse that you have done something extraordinary, please do let us know. For that, you can also earn that award. If you know someone who have done something, who has done something extraordinary as being a nurse, please do nominate them as well. All those details are given in the very same page that you're watching, as well as in Telegram group. Everywhere we have given. So, and do share so that there are some other who knows or who can be that winner. Isn't it? Last year we had the opportunity to meet a lot of nurses who have done great things in their life. So it was an honor to meet such a kind of nurses. So this year also we are really looking forward to see all those names, all those lovely people who have done extraordinary. Sophia Francis, good afternoon. Priya Nair, good afternoon. Ashley Thomas, good afternoon. A lot of new names, but if you are new, please do let me know that you are attending for the very first time. Pravina Ravi, good afternoon. Alexander Graham Bell, hi, how are you? So that is about the nurses. Not only that we only look after nurses, we look after the upcoming buds of nurses as well. So we give an award to the best nursing student as well. Okay, so those are the things that we do. So if you're not aware of it, please do see the pages that you're watching where we have given all those details, especially on the Telegram group as well. We have been posting it. Geetu Krishna, good afternoon. Lakshmi Devi, really beneficial classes. Thank you very much. So, Ashley, first time. Thank you very much. Ashley, where are you from? If it is okay for you to tell. So, what are we going to do? We'll be talking about two things. One, a part B, and the part A questions which I've already shared in the exclusive Telegram reading page, as well as in the very same page that you're watching. See, the exclusive Telegram page is the first stand where you get ample amount of information about reading, and that is where we post. And there is a small criteria that we accept you into that group. We scrutinize it. So our admin will ask you to send certain details. After double checking only, we'll be accepting you into that group. So if at all I have missed any of your name, Bibin Pies, good afternoon. It's not deliberate, okay, because the name just pops up. So I'm not able to read. Maybe I'm not too quick enough. Okay, really sorry for that. It's not deliberate. Anil Gopalakrishnan, good afternoon. So as you have all there, now let's go into today's first topic, that is part B. Liba Liban, good afternoon. The question will be coming on the screen. As soon as the question hits, there will be a timer. Please do complete with the time and do complete the answers. Do not write the answers. I will ask you when to write the answers. അപ്പോൾ നിങ്ങൾ ക്വസ്റ്റ്യൻ കാണുമ്പോൾ ജസ്റ്റ് സ്റ്റാർട്ട് ഡൂയിങ്, ഫൈൻഡ് ദി ആൻസർ, എവിടെ നിന്ന് കിട്ടിയെന്നും കൂടെ ഒന്ന് കണ്ടുപിടിച്ചേക്കാം. ഓക്കെ, ആഫ്റ്റർ ദാറ്റ് വിൽ ബി ഡിസ്കസിങ് ഇറ്റ്. Are you all ready? If so, give me a thumbs up before the question. Shiba, good afternoon, before the question pops up. എല്ലാവരും റെഡി ആണെന്ന് വിശ്വസിക്കുന്നു. So the question will be coming on the screen no sooner. It will have a timer. Shija, there you have the question. So please do complete the question and find the answer. Then we will discuss. അപ്പോൾ നിങ്ങൾ കണ്ടുപിടിച്ച ആൻസർ കണ്ടുപിടിച്ച just put a thumbs up or say done. That's all what I need. Time just went, doesn't it? It just goes very quickly. So I hope all of you have found an answer. Did you? I've missed few names whom you have missed. Okay, a very good afternoon, good evening, and good morning to all of you. So have you all got an answer? Yes, few of you have said yes. Anju Korean and few others have said. Bharati have said. Krishnendu has said hi. Lakshmi Devi has said hi. I'm sorry, done. Neethu ji jo hi. Rini has done. Rabbi Anup has done. Anju Korean. Okay, so as you have said that you have done, let's see what are your answers. Would you be kind enough to tell me what is your answer and where you got the answer? That's very important. Not just what is your answer, where you got the answer. Sheija done. Linta George done. Jyoti Thakur, yes. Liba Libin done. Lakshmi Devi done. Excellent. Sarangi, good afternoon. Sneha KG, yes. So all of you have done. Now please be kind enough to tell Rani Robin done. Please be kind enough to tell me what is your answer. Most importantly, where you got the answer. Daya Sojan, a new name. Done. Abraham Chaku, done. Ashley Thomas, done. Jubi Mol Joseph, done. Tintu Saga, done. Excellent. Anu Anil, done. Lot of new names which quite not very familiar with. Tina Agnes, done. Ramya Anup, A. Okay, fair enough. The first one I got is Ramya saying A. Sneha is also saying A. Okay. Where did you get A? If you have got whatever. Albi Maria Anthony, A. Binu George, A. So all of you are saying A. Sarangi Shinju, A. I just need where you got the answer. So Tina Agnes, A. Linda George, A. Mayusha CS, A. Sneha, sorry, Shija, A. Shija Binoy, A. Okay. So most of you, I think all of you, whomever I've told, have said A. Rani Robin, A. Liba, A from the whole para. Okay, fair enough. Abraham Chaco, A. All right. So most of all of you are saying A. There's no other option. Don't think that just because that all the people have said A is the right answer. Yeah, there are times where all the students went wrong as well. So Jane John A, Anu Anil A, Lakshmi Devi A, Sophia Francis A, Jubi Mol Joseph B. Okay, fair enough. Veena Borel C. There you go. Thank you. So I have A, B, and C. Good. So Tintu Sagar is also saying C. Sarangi is saying whole para A. Okay. Ashley Thomas is saying C. Okay. Now C is picking up, is it? Sajna James C from first part. Okay. There you go. Rini Joji A from whole part. Okay. So it's a mix of A and C now. Just only one person with B and all the others are A and C. Now let's see what the answer is or why, how can we find the answer. Krishnendu is saying A, Mayusha, all para mention function. Okay, fair enough. Now let's see how we are gonna look into part B. Lakshmi Devi answer is mentioned in the first two sentences. Ashley from first two sentences. Okay, now first two sentences are also coming up. Now let's see. Now when you're doing part B, okay, first and the foremost important that you have to understand is the type of question is multiple choice questions and you're expected to find one right answer. Okay, where the other two are not the right answer. So the most appropriate strategy to find the answer is called elimination method. Now, how would you eliminate? You read the question. There are two. Of course, first and the foremost important thing when you're doing a part B, you have to read the question, underline the keywords in the question, understand the question. Now, as I've mentioned, read the question, understand the question, underline the keywords in the question. Now, what is the question saying? Question is a very simple question. The given notice talks about or notice is about. What is it talking to you or inferring, telling you? Now, after this, you have two options. Okay, one, you can read the paragraph and pick an answer. Or if you're like me, I'm a person who would like to know what I'm searching for. So I read my answer option, then I pick it up from the paragraph. Okay, now the question will come in front of you on the screen. Okay, after that, so you will get a more insight about. So again, I repeat, the strategy to do part B is called elimination method. And part B is considered to be a smaller thing, where you have only 6 questions. And these 6 questions, you have to complete it. The maximum time that you can take for part B is 2 minutes per question. And the 6 question would be having 6 different focus. It will not be taken from one content. It will be taken from different extracts. Okay. So in the meantime, before the question comes onto your screen, is there anybody who still want to comment what is your answer? Anaga Annus, good afternoon. Okay. See, there are lots of people who are late, but still, I'm so obliged to all those people because that shows your eagerness to come and attend our live session. So the question will be popping on the screen. So once the question comes, it will be easy for you to understand as well. Lydia Paul, hello. Hi, Lydia. Anybody else want to comment on the answers before the question pops up? Once the question pops up, I'll start discussing the answers and how you arrive. Suprema Subramanian. Good afternoon, Suprema. I think you're very new, a new name for me. If it is okay, please do let me know where are you from. Sanila Shafir, good afternoon. Sita Tarshini, good afternoon. So the question will come on the screen in time before Lita Anna Rahul. Yeah, Lita, new name Lita. Right, there you have the question. Now let's go in deep with the analysis. So as I've marked already, the given notice is about. So very straight. Now you can read the answer option and then pick an answer from the paragraph, or you can read the paragraph and then pick any of these. Now I am a person who would always go as what I teach. So I will look at the question, answer option, underline the keywords. So functioning of ultrasound. So first option, my keyword is functioning because whether it is talking about all the functioning of ultrasound. Or, generally we say ultrasound, but when you go abroad, you start hearing ultrasound. Okay, so those is how our pronunciation difference are. Next question is detection of fetus. Is that what the whole notice is talking about, or examination of fetus? Okay, now let's see ultrasound. So that is general. So ultrasound is done during pregnancy to track the development of the fetus in the mother's womb. So it is done during the development, or track down the development of fetus in mother's womb. So detection of fetus, no, it is not. Detection is different to development. Okay, see, detection means what? The action or process of identifying the presence of something. It is not to detect, it is to track the development. Okay, so this one for me is a straight eliminator. But still, I'm not confirming it yet, but let's see. It is not only helpful in tracking down the development, but also help to find any fetal anomalies. So it is not just about, even if you say detection, yes, it is paraphrased, but it is not only for that, but also for finding out fetal anomalies. What is anomalies? Again, a common terminology which your healthcare professionals use, isn't it? Anomalies means something that deviates from the standard normal or expected. So something which is extraordinary or anything happening abnormal. So that is not there. Ultrasound reveals the heartbeat of the fetus, the radius of the head, the length of the hand and feet, and also his or her height and weight. There are various kinds of ultrasound which can be done during pregnancy, namely transvaginal ultrasound, 3D ultrasound, 4D ultrasound, and fetal echocardiography. So they are talking about different kinds of ultrasound also. While the sonography reports in the first trimester provides information about the fetal heartbeat, it also examines the placenta, uterus, ovaries, cervix, checks for multiple pregnancies. The sonography done in the second and third trimester reveals much important criteria like placental abruption, placental previa, characteristics of Down syndrome, if there is any possibilities. The ultrasound in this stage also determines whether the fetus is carrying any form of congenital disease, whether hereditary or non-hereditary. So now the problem is, see, we always talk about, yes, all those things are there. See, the most important thing is about understanding the meaning of those words. That's the problem. See, now examining, now that's the word which is having a problem. And what is this saying? Examination of the fetus. So examination of the fetus means you're literally examining it, isn't it? That is a detailed inspection of the fetus. Now, are you giving detailed inspection of the fetus? No, not at all. It is not giving any detailed inspection of the fetus. It is not examining of the detailed way of the fetus. It is generally used for what? Throughout the time it is talking about what is the function of ultrasound. What is the function? It is used to track the development of the fetus. It's not only that, but also it helps to track down any anomalies. Okay, then on top of that, what does it relieve? So it is also helping in heartbeat of the fetus, radius of the fetus. So these are all the usage, functioning of ultrasound. So as what the majority of the people said, the answer is A. Now, how would you mark or identify the examiner that this is my answer? You're going to bubble the appropriate letter. Understood how you're going to do that? Leave A. Keep on dancing. Good. As long as you all get the right answer and enjoy what is your achievement, isn't it? So any doubts with regards to my explanation or anything you want me to clarify? Jyoti Thakur is saying, understood. Anu Anil is dancing. Keep on dancing. I always enjoy when people do cherish their achievement. You have to, isn't it? Let it be small or big. I have made that. That should be the spirit. Good enough. Shija, thank you. Sajna, yes. Neha, yes. Tina, yes. So no doubts. Yeah, so you don't have any doubts. Very good. Teaching you all is the most privileged thing. Why? Not much of an effort because you're all capable enough of finding the right answer. Even if your answer went wrong, it's not bad. Why? You're being corrected. That is why we are here for you. Okay, we all from Neethu's family are here to make sure that we become the bridge between you and your reality. I'll be saying, oh, okay, enjoying. Good. So, as you said, there is no doubt. Shall we go to part A then? Ramya Anup is saying, yes, understood. Is there anything that you want me to clarify? Yes? No, all of you have got the thing done. Excellent. Good, 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 good. So, what are we going to do in part A, isn't it? Part A. What is today's part? All clear? I don't know. My nose is very much itchy. Sorry. Sarangi understood. Lakshmi Devi clear. Liba ready for part A. Fair enough. Jyoti Thakur, yes. Jubi Mol understood. Very good. So as we always say, we will not let you wait. We'll go to straight to part A also. So tell me, yeah, Anu Anil is already a step forward than me. She's already saying it is laminectomy. Sarangi, no. Divya, clear. Rini, yes. Okay. So as sorry, I missed your name. Anil have said it's laminectomy. Liba is saying it's easy. So all of you know what is my next question, isn't it? Am I happy? Or have I become very predictable? Yeah. So Savita, yes. Pravina, clear. Lintel laminectomy. So as you all started saying laminectomy, I would definitely want to hear from you how you felt about the material. Simple topic, Lakshmi. Okay, fair enough. I like that. So Neethu madam has been very kind enough to provide simple material, is it? Easy material, no? Okay, fair enough. So you have said compared to it's a mix of material that she provides to you, isn't it? Coming from simple, easy, tricky, confused, hard. So most of you are saying easy. Okay, so I think it should be easy because we'll have to go with the majority, isn't it? So even Ramya is saying easy. All right. So how many of you, all of you have done the material, isn't it? Yeah. So if you haven't done the material, then please do the material. See, that's another request. Yeah. When you're coming in for the live, please do the material. That's why we are sharing a bit early so that you have ample amount of time to take the printout and also do the material because the maximum time that you're going to get is 15 minutes. So you have to be quick enough as well. Into yes, done, good enough. So that's also the reason why we give you the material a bit early. Before, if we wanted to make sure we really thought of giving you the material live, then what happens? It's not possible for all of us to take the printout, isn't it? So those are the things that we have done under consideration. So as your request, you wanted us to send the material early, so we have started sending the material early as well. Right, Ramyanup, yes, sir, done. So your material will come on the screen. So what is the strategy? Now that is the next important thing that you have to really look for. Part A has a different strategy in contrast to part B and C. Part A strategy is called skimming and scanning. If you're not aware of and how to improve on your score, we have done an exclusive video on tips and tricks of part A. Okay, so please do refer to that video so that you will get more insights about how to improve on your scores and what are the things absolutely expected. Yeah. So Lakshmi Devi is saying skim and scan. Lever is saying skimming and scanning. Okay, fair enough. You all know everything. Good. Now, if you really look into the part A, the first and the foremost important thing that you have to always understand is you have to skim. Now, part A will have four texts. Text A, text B, text C, and text D. Out of the four texts, one would be a pictorial representation, a minimum. And the rest would be either a combination of either it can have another pictorial representation or generally it will be three texts. So each pictorial representation, you have to underline the keywords as well. If it's a graph, you know what to do. Now this is a table, isn't it? When we select, we definitely look into the aspect of how to enhance your skills. Now when it is a table, okay, see, please do understand, table doesn't have x-axis and y-axis like your graph. So table, although has rows and columns, isn't it? These are called rows and columns. So that does play a pivotal role. So in a table, the keywords are your rows and your column. So the keyword that you're going to underline should be the heading of the rows and columns. So here drug class, general recommendation, special consideration, blood pressure medication, blood thinners, diabetes medication, heart medication. So diabetes, heart, immunosuppressants, steroids. These are my keywords on the headings of rows and columns. After that, of course, go skim through the given other text and underline the keyword. Maybe taken the day, spine surgery, after surgery. You should have blood pressure checked several days before the procedure. So you should have primary care. The medication dose is needed. The operation must be delayed if you're not under control. So blood thinners, stop using blood thinners before your spine surgery. Your surgeon will tell. So surgeon will tell you stop taking. You must prescribe short-acting hyphenated word. You can be used in several hours. Before the operation, you can start taking blood thinners once approved by your surgeon. So usually 24 hours. 24 is a keyword. Why? It's a number. So blood thinners are a concern because, so again, blood thinners are a concern, and the bleeding during the surgery raises the risk of infection, post-operative anemia, additional drug-specific thinners, information included, table 2. So we're not worried about table 2 because there is no table 2 there. So diabetes, your insulin must be adjusted in the day of spine surgery, and after recovery, to take oral diabetes. So oral is a keyword. Medication you may need to stop taking before you're given anesthesia, may be continued in the day of spine surgery, all and throughout your hospitalization. If you have had a heart attack or other heart problems, your surgeon may recommend a pre-operative cardiologist. So you may be presented additional heart rhythm, beta blocker before the surgery to reduce the heart operation during the procedure. The surgeon will let you stop taking in the period of before your spine surgery. Immunosuppressant shows healing after surgery. Your spine surgeon, again, a different terminology, anesthesiologist may give additional steroid dose, start a procedure. Long-term keywords such as prednisone surpasses the adrenal gland, which makes the steroid your body inadequate level of steroid during the surgery can lead to blood pressure. Now see, each text you have to, the maximum you have to allocate is about, let's say, 15 seconds. So that is the easiest way to underline the keywords. Now let's go, after underlining the keywords of 4 text, then only you're going to go and underline the keywords in the question. So now we will see, because keyword reference is the only way where you can find the answers in part A. Okay, now what? Now these kind of WH questions are important. What are the abnormalities associated with the accumulation of pressure, spinal cord, and nerve roots? So very specifically, they're asking you abnormalities, accumulation, spinal cord, nerve roots. So where have you underlined all these keywords? So all these keywords, if you really look into, I have underlined as such in text A. A laminectomy is often does not relieve the effect of spinal stenosis. In condition, your spinal column narrows, so spinal column narrows, and pressure on the spinal cord or nerves. So what spinal stenosis are caused? All those things are mentioned in text A. So what becomes the answer for the first one? The answer is A. Good enough. Next question. The vital thing that must be done in the 48 hours following a surgery. So vital thing 48 hours. So where are they talking about all these vital things? So I remember seeing 48 hours in text C. Now scan that area. Initially, you will be shown how to roll over in the bed. You are taught in the proper method of rolling your body in order to maintain posture ball. This is the most important, so vital thing, most important, the first 48 hours. So the answer to question number 2 will be C. Significance of certain drugs during and after procedure. So where have we detailed about drugs? I know only one place where you have been given about the drugs, and now where they are talking about after and before and all those things are mentioned in text D. See, you really don't have to waste your valuable times on the aspect. Is there which word, which sentence is it? Generally about drugs, okay. I have, as I'm skimming, during and after procedure is mentioned in text C. So if you really look into where you want to have, here also it is clearly saying you may be prescribed additional beta blocker drug before the surgery, after the surgery. So that's where the exact point is. So the answer is D. Cleansing agent to sterilize surgical sites. So where have you mentioned about these cleansing agent? So cleansing agent, I know that I have read out, clean the skin over the surgical site with an antiseptic solution to help prevent bacterial infection. So the cleansing agent is mentioned in text B. So the answer is B. Now, next question. Additional procedure done along with the surgery to achieve a proper balancing of the spine. So, additional procedure. Again, it is something that I have read in text B, because during the procedure, your surgeon may also perform a spinal fusion. Additional procedure is spinal fusion, which two or more bones are connected in the back before better stabilize spine. So the answer to the next question is also B. The link between blood thinners and infection. So blood thinners, infection, do we really have to have any second thought? Blood thinners, and what is the infection? So what are they talking about? Blood thinners are concerned because bleeding during and after surgery raises the risk of wound infection. So the answer to that question is D. This is how you refer. Guidelines to be followed by a patient underwent laminectomy recently. So recently, not necessary, but what is the guideline? So guideline, I know that there have been given in text C. After the operation, you can expect. So after the operation, you can expect is where. So that means the guidelines, isn't it? So this is where, or this is how you refer keyword. So anybody have any doubt? If so, please do let me know. If not, okay, we will go into the next question. Yeah, the next question, next type of question are called short answer question, where you are expected to find the answer. The question will start from 8 to 14. So 8 to 14, your question will be short answer question, where you are expected to find the answers. Okay. What are you going to do? You're going to find the answer. The answers are as simple as that of a word, number, or both. Okay. So it can be a short phrase also. So before, okay, before you used to get longer answers. Now you won't get such a kind of longer answers now. Okay, now short phrase. Now let's go into the question. How are we gonna do that? Okay, so condition where spinal column gets narrowed, pressure, spinal cord, nerve roots. So do we really need to worry about where did you find that? Because we have already gone through that in text A, isn't it? So straight away what you do, I know that I have marked in text B. So what should be the answer? The answer is very simple. Yes, the answer is right. Spinal stenosis. Spinal, and you get that in here. Spinal stenosis. Okay, so the answer comes from text A. Very good. All of you have got the answer. Excellent. Now the next question. Next question is 9. Common parts often gets removed. So that's enough. Laminectomy is understood, isn't it? So common parts that often gets removed. So what are we going to talk about, or where are you going to? Again, I know that I have read in text A. So lamina is the part of the bone that forms the vertebral arc in the spine. Your doctor will also remove bone spurs. So what are the common things that you're going to be removed? Lamina and bone spurs is the two answers. So you can just write it with not just lamina. The doctor will also remove bone spurs. So those two have to be written. Why? Because please look into the question. This is where you're missing something. Is the question asking you common part or parts? The common parts. So it should be more than one. So lamina, comma, bone spurs. Both have to be written. Okay, this says where you just went a bit. They didn't look into the question properly. Yeah, no problem. The medication prescribed prior surgery to avoid unwanted heart complications during and after surgery. So during and after surgery, where are we talking about? I know that I know the answer is somewhere in text B. Now, where is text B talking about? So what is the thing? It is clearly saying during and after surgery must be prescribed additional heart medicine, a beta blocker. So what is the answer? The answer is, you can write it with or without the article, a beta blocker or beta blocker. Anything is a safe answer. Excellent. Now the next question. The next question is talking about what might be incorporated intravenous fluid which would be administered in the following days of surgery. So very specifically it is asking you what is administered following. So following, I know that after, isn't it? Following means after the operation. So I should know it should be somewhere in here. Now all my keywords are as such, isn't it? You may have intravenous fluid for a few days, which may include an antibiotic. So an antibiotic, anything is fine. Good, all of you have got the answer. Now question 12. The material used to wrap the cut after putting stitches. So material wrap cut after putting. So where are you talking about, or where do you get that? You get that again in the answer as sterile bandages. Where do you get that? You get that in text B. So it's clearly saying cover the incision. Incision means cut with sterile bandages. So what is the answer? The answer to that question is sterile bandages. STERILE BANDAGES. Excellent. Question number 13. Unstable occurrence of vital sign may lead to postponement. So what is the vital sign? Unstable occurrence. So which is the occurrence? Let's see where they are talking about the unstable occurrence. I know that it is there in text D. You should have blood pressure checked. So several days before the procedure, your primary care doctor can adjust your medication dose. If needed, your operation could be delayed if your blood pressure is not under control. So unstable. Very good. Blood pressure is a two-word answer. BLOOD PRESSURE. Excellent. Question number 14. How long, okay, it's definitely going to ask you the frequency requires to execute laminectomy. So how long? So very straight answer. What is the time frame? So I know that I have underlined it as a keyword. Why? Because usually numbers are your keyword. A laminectomy usually takes 1 to 3 hours. So answer is 1 to 3 hours. Good enough. Now for the final stint of fill in the blanks, where it starts from 15 to 20, where you are expected to write the answer of word, number, both, or a short phrase again. Dash is the surgical procedure in which the area where the nerve roots go through spine widened by surgeon. So surgical procedure, nerve root, widen, surgeon. So where are they talking about? All these keywords. So all these keywords, I know that I have underlined that one specific word. Why? Foraminotomy. Foraminotomy. So where is that? During the procedure, your surgeon may also perform a foraminotomy to widen the area where the nerve roots go through the spine. So very straight answer, Foraminotomy. Excellent. Now question 16. A dash will give you specific instruction on how to get out of bed, avoid stress, strain, wound side. So I know that this is somewhere where I have already gone through, isn't it? So who will give me? Okay, where do I do that? Okay, it is there in C. I know that after the operation is what they are going to guide me through. So what are they saying? They're saying you will be held up the bed usually. So who is doing that? The physiotherapist will give you specific instruction. So PHYSIOTHERAPIST. Excellent. Question 17. A steroid long-term use suppress active adrenal gland steroid your body needs. So where are they talking about steroids, adrenal gland? Of course, I know that it is only mentioned in text D. So what is a steroid? The answer is prednisone. So long-term treatment with steroids such as prednisone. So PREDNISONE is the answer. Question number 918. In Paget disease, so Paget is a keyword, we could trace inappropriate growth, and this condition causes spinal stenosis. So where is spinal stenosis mentioned? Okay, it is there. Where is it? It's there in Paget disease. So what is the answer? The answer is the growth of bones. Why? It's straight in text B, text A only, isn't it? That's the only place where spinal stenosis is there. So where is it talking about Paget disease? Next keyword. So where is it of the bones, where the condition of which bone grows improperly? BONES is the answer. Question 19. You need to stop taking dash before you are given the anesthesia. So where is it talking about anesthesia? You are given. So they are talking about anesthesia in the table again. Where are they talking? Anesthesia is there in diabetes medication. So what are they telling? If you are taking oral diabetes medication, you may need to stop taking them before you are given anesthesia. So it's a three-word answer. Oral, ORAL, DIABETES, MEDICATIONS is the answer. Now for the ultimate question for today. Initially, in order to sustain appropriate dash, you will be shown how to roll over bed. So roll over bed, I know that I have already dealt with that in text C. So that is where my physiotherapist and all is going to talk about. So the next one, so what is the thing? You will be shown again the proper method of rolling your body in order to maintain what? Body alignment. BODYALIGNMENT. So I have wrapped my 20 answers. Now it's high time that you start telling me what are your doubts, if you have, and what are your total scores. If you have any doubts, please be kind enough to ask. I'll be happy to address you. Is there any doubts, or is there anything that you want me to clarify? If not, Sibi, 17, excellent, good enough, keep it up. Jyoti Thakur, 19, excellent, good enough, good. Vinitha Renu, 19, excellent, good enough, good enough. Keep it up, keep it up. Josephine, 18, excellent, good enough. Ramya Nub, 18. Saumya Shijo, 19, excellent, very good, keep it up. Linta, 19, very good. Sarangi, 20, absolutely stunning. The first person to say 20. Very good. Liba Libin, 19, is also happy. Do enjoy, yes, good enough. Nimi Paul, 18, excellent, keep it up. Good, good, good. Tina Agnes, 17, very good. Jyoti Thakur, question number 9. Could you please repeat? Question number 9, common parts. Parts means more than one, isn't it? Because it's a singular, no, it's a plural. So that should be more than one. So there it is talking about lamina is a part of the bone that forms a vertebral arc in the spine. That is where you generally, so what is it starting saying? A laminectomy is a type of back surgery used to relieve compression of the spinal cord. During the procedure, your doctor will remove the lamina. So what is the most important thing? Lamina. Not only that, your doctor will also remove bone spurs. So what are the common parts? Lamina and bone spurs. Clear? Soumya, thank you so much. Thank you for all those what is that? Bouquet of flowers. Thank you. Clear? I hope it is clear now. Yeah? Neenu Alex 20. Very good. Neenu, excellent. Keep it up. Good enough, good enough. Anu Anil 18. Very nice. Tintu Sagar 18. Very good. Lissy 18. Good enough. Sneha KG 17. Rani 19. Very good. Neenu Alex. Lita is saying thank you. Tintu Sagar 18. Very good, very good. So is there any other doubts? I've already clarified that question number 9. Is there anything else? Jyoti clear. Okay, fair enough. So anything more? Anybody else who have any doubts? Sarangi, thank you. Thank you very much. So one small request. It's the mutual thing on the aspect as we have offering you all these classes, and we would definitely want to know how you feel about it. Yes, of course, you're commenting. Okay. Nino Alex, thank you. Pravina Clear, thank you. Anu, 19th answer, I wrote aspirin. No, it is not, isn't it? Rini Joji, thank you. So we also would like to make request, one small request from all of you is to share the maximum. See, please do share whatever the social media that you are watching. Please do share so that more students will get the benefit. That's the whole idea why we come in with all these classes. Okay. So Nimi Paul is saying thank you. Vinitha Renu is saying thank you. Thank you very much. So do that nobility because we want to make sure that we reach all the students who are in need, because there are still students across the globe who doesn't know that we are providing these free classes for you. On top of that, if you want a professional approach, we are definitely providing our classes where you can see the next batch available is only from July, August, and September. And we do have crash courses available. We have a lot of other linguistic exams that we give training for. And do not forget about the Nurses Day Award. So these are the few things that we would definitely want all of you to have a look into it. Okay. So as you have started saying thank you, I would also say thank you so much for giving us another opportunity to come in front of you. It was another blessed day to have all of you. Really looking forward to see you tomorrow. Until I see you tomorrow, it is adios from all of us. God bless you all.